We can do this. We absolutely can do this.
This is the first time any big effort has been made to raise awareness or try to get any funding for cervical cancer.
You will be sitting tomorrow in the offices of some of the most powerful people in this country.
I want them to be touched by my story. I want them to realize that when other people come in their office and start talking to them about these numbers, that the numbers have faces behind them.
My name is Carol Harris, and I'm a stage 3 cervical cancer survivor from 1992.
I have cervical cancer right now. I am stage 4.
Know that your struggle as a woman with cancer, the story of your struggle providing support to women, these are powerful stories that breathe life into the science and into the statistics.
What do you do if you don't have the money and the resources to continue to get the tests that you need? Where do they come in at? What are the dynamics that they can do to ensure that everybody gets treated and treated fairly, and not because you don't have the money?
So thank you for inviting me. I'm very pleased to be here on behalf of the Obama administration. And the department and President Obama are very dedicated to reducing health disparities and addressing them. But the main thing I can tell you right now is that there's no need to be intimidated. You all are the most powerful people. The most powerful people that will be in that room, and your stories are going to mean the most.
Dr. Seuss says, and this is what I thought about, this is so perfect, when Tamika brought you in, it's like, okay, I'm bringing in the big guns now. You know, you all are messing around on this, so I'm bringing in the big guns. So this is more Dr. Seuss. I have heard there are troubles of more than one kind. Some come from ahead, some come from behind. But I've brought a big bat. I'm all ready, you see. Now my troubles are gonna have trouble with me. So,
We are here to charge on Capitol Hill on Wednesday.
Cervical cancer is the #2 cancer killer for women worldwide, with 288,000 deaths each year. In the United States alone, there are 11,000 new cases and 4,000 deaths every year. The more accurate statement is, no one should die from this disease. Hispanics are more likely to be diagnosed with cervical cancer compared to whites, and African American women are twice as likely to die from the disease compared to whites.
And as Tamika and friends has reminded us, half of the women who die of cervical cancer have either never been screened or haven't been screened in the past 5. So it's unacceptable. It is preventable. Cervical cancer is preventable. We need to raise awareness about the disease. We need to encourage women to get tested. And perhaps, most importantly, we need to give them the tools and the resources that they need in order to be able to survive.
So there's a lot of women that do not know of the resources, or there's no funding left in the resources for these women to get screenings.
I just want you to know that the President, the administration, Secretary Sebelius are focused on prevention. They're focused on reducing health disparities and really focused on making sure that everyone gets the regular care and checkups that they need to keep themselves healthiest and to prevent things like cervical cancer.
I yesterday gave my little spiel on the floor. What we did was we acknowledged that January is Cervical Health Awareness Month. And we have a resolution that we passed on the floor with regards to the fact that cervical cancer is probably one of the biggest and worst at the same time cancers for females, the largest killers, and most preventable.
Our goal this week is to have cervical cancer worldwide promoted, for legislators to pass a bill for funding for that, so that every woman, no matter what insurance level they're on, could get treatment for it, because it is curable.
But you have to be an advocate, and I wasn't. I just listened to my doctors. I didn't push. Be an advocate. If you get an abnormal pap, force your doctors to take steps. You know, research what's going on, you know, be an advocate, because sometimes your doctors won't be an advocate for you.
Women talking to women, that's a really good way to spread information. I think Tamika and Friends programs with their house parties at 5 and the project she had with Christine Bays in the Say Something campaign, and really setting it up so people have the tools and they can talk about those things. But you have to reach out and access, organizations and reach women who aren't hearing this, who have not had cervical cancer themselves, who have not had a sister or a best friend. Those people sort of in like the second and third tier of connections, and get the message to them.
This is something that we really need to get the word out about, so women know that they can go in, where they can find resources to get screened, so they don't have to go through any treatment or let this get advanced.
Heather had a clear pap smear in December, and in May had an 8-centimeter tumor and died in December.
Donna, who you'll speak with, her sister Heather, didn't have health insurance. She didn't get the same treatment that I did, and she died. And I believe that I lived because I had the best treatment. And that's not fair. Not in a country, like the United States, not in any country, but we have the power to make sure that when someone is diagnosed with cervical cancer, that they get the kind of treatment they need to survive.
I am a strong woman, but I am a big cry baby. And I'm sitting here my cup is just overflowing with joy at seeing you all here. Some of you I know, some of you I feel like I know because we've talked for months, we've talked for weeks, we've talked for days, but we have that one common thing between all of us, that somehow cervical cancer came into our life. There was a woman, a young lady, 31 years old from Connecticut, who was supposed to be here with us. I spoke to her on December 7th. She was very excited. She was going through chemotherapy, and this was her first time doing anything cervical cancer related. And she couldn't wait to come and be with her survivor sisters and feel that empowerment because she was going through treatment. December 17th, I went on Facebook just to go and see what everybody was doing, and I learned that my friend who I'd never met, but I had become extremely close to on Facebook, Kristen Meyer, 31 years old, died of cervical cancer. Kristen is not here with us, so it's imperative that we not only tell our stories and our loved ones' stories, but we leave here and we tell Kristen's story. Because that is someone's daughter, that is someone's sister, that is someone's auntie who is not here to tell her story. So I ask you to remember why we're here, to remember what we're doing. We're gonna have a lot of fun. We're gonna have new experiences that we have together, that we'll be able to talk about, that will bind us forever. But keep remembering in the back of your mind why we're truly here. Because it's not just about the people in this room, it's about all of us.
If Heather's story touched one person, then it's enough. She said, I don't want to die in vain. I don't want another woman to go through what I went through.
Somebody is listening to the voices of the advocates, the survivors, the people who's just here supporting, that we do have a voice and that they're willing to listen and that they're willing to help, get involved, and see that no woman that has cervical cancer need die from it.
That we are a generation that has the ability, we have the tools, we have the power to eliminate a cancer is an extraordinary gift that we have. And your gift is the ability to go there and deliver that message.
I couldn't make a difference without each one of you. So thank you, thank you, thank you.
Thank you so much for the work that you're doing. Keep it up.
So why we're here is, first of all, representing Tamika and Friends and cervical cancer awareness, and I know you know quite a bit about it now, is making sure that we're taking care of not only reproductive health, but the health of humankind and mankind as a team, knowing that with the CDC...
It starts today. It starts today realizing it's about coming together and making a national impact and continuing to make an impact in our local communities.